Commonwealth is insisting there is enough supply of children's COVID vaccines across the country as it tries to dismiss criticism about supply pressures and appointment cancellations. 2.3 million children aged between 5 and 11 are now eligible for the vaccine, but getting access to it is proving difficult for some. Political reporter Matthew Doran is in our Parliament House Bureau. Matthew, what's the situation for parents trying to get their children vaccinated?
Well, Karina, good afternoon to you. Over the last couple of days, despite having some of those bookings, those appointment bookings in place, many parents have been receiving messages saying that those bookings had to be cancelled because the GP clinic or the pharmacy or the state clinic that they were hoping to get their children vaccinated through simply did not have the supplies to meet the demand. This is the first day that children aged between 5 and 11 have been able to receive those vaccinations. The booking process opened a number of weeks ago, but hearing from a number of parents that there are these supply shortages around the country. The Commonwealth health authorities are effectively saying to parents that they need to be shopping around. They need to be looking at other available options for them. If they can't get it from their GP, to go to their local pharmacy and to try to figure out where those supplies currently are, while conceding that there are delays in the system. The message to parents is to be patient and to allow the initial teething problems in the system to work its way through. It's unlikely to be comforting for many Australian parents who are seeing this surge in cases of the coronavirus right across the country, and we are getting closer to the start of the school year. But the message from John Fruin, the Lieutenant General who is in charge of the COVID-19 vaccine task force, is that there are thousands of places around the country where families can get their children vaccinated. It's simply a case of finding where they are.
I do understand if there have been frustrations around getting appointments for some, that please, if you can't get an immediate appointment with your primary healthcare provider, if that is your GP, please do try the pharmacies, please do try the state hubs. There are additional bookings coming online every day, and there will be more and more opportunities over the weeks ahead.
And Matthew, what impact will any delays have on children returning to school?
Well, this is the unknown for many parts of the country at the moment. We've heard from Queensland that it is delaying the return to classrooms for its students. New South Wales trying to continue with the current plan as it is, but other states and territories yet to unveil their thinking about whether the slower or any of those supply issues when it comes to the Pfizer vaccine for children are going to impact the return to school. It's a bit of a double-handed situation here. On the one hand, it's to do with those supply pressures on the vaccine getting into some of those communities, even though the Commonwealth is saying that there isn't really a problem as far as it sees it. But then there's also the situation with regards to the first and second doses and the interval between them. The expert advice from the Commonwealth's vaccine group, ATAGI, is that there is an 8-week period between the first and second dose. So that is also factoring into the planning and the thinking around sending kids back to school. The Prime Minister says that it will be a matter discussed at National Cabinet later this week, but he isn't expecting other states to follow Queensland's lead and delay that return to in-classroom learning.
Hopefully there'll be a lot of agreement on the principles that are being applied, but obviously if those principles or the situation on the ground is different, and we often see that in places like the Northern Territory, for example, which has a very different population to many other states and territories.
That's the Prime Minister speaking earlier today here in Parliament House. His messaging for the Australian community as it looks at this rise in the number of COVID-19 cases across the country is that Australia needs to continue to push through it, despite how concerning those high figures may well be.